Welcome to Fila Health Systems of NC staff training on the client intake process. At PHSNC, intake is the first formal step in helping individuals and families access the care, support, and services they need. Our mission is to provide person-centered, compassionate, and clinically sound behavioral health services that empower individuals and families towards stability, independence, recovery, and a meaningful quality of life. The intake process helps us meet people where they are, identify their needs, address barriers, and connect them to the appropriate level of care. Every document in the intake packet has a purpose. Every form builds on the form before it. If one step is incomplete, inaccurate, or skipped, it can affect clinical decision-making, client safety, compliance, authorizations, documentation, billing, and the quality of care we provide. At PHSNC, intake is the beginning of the golden thread. The intake packet is completed in assigned stages. Step 1 may be completed by anyone who receives the referral or service inquiry. Steps 2 through 16 are completed by the intake specialist or qualified professional, also known as the QP. Steps 17 through 22 are completed by a licensed professional or approved designee, including an outside agency or provider when PHSNC has an approved agreement in place. Steps 23 through 25 are completed by the intake specialist or QP. Each role is responsible for ensuring their assigned section is complete, accurate, signed when required, and properly entered or uploaded into the client record before the next stage begins. Step 1 is the referral or service inquiry form. This is the first point of contact. It may be completed by anyone who receives a referral, including administrative staff, leadership, program staff, or another designated team member. This step captures the basic reason for referral, referral source, client contact information, requested service, presenting concerns, payer information if available, and any urgent needs. This step is important because it starts the intake process. If the referral information is incomplete, the intake specialist or QP may not have enough information to make timely contact or determine the next steps. Step 2 depends on Step 1 because the initial contact or intake call log uses the referral information to reach the client and begin formal intake engagement. Step 2 is the initial contact or intake call log. The intake specialist or QP documents attempts to contact the client or guardian, the outcome of the call, basic needs discussed, and whether the person remains interested in services. This step confirms that the referral is active and that the individual is willing to continue the intake process. This step depends on Step 1 because staff need accurate referral information to contact the client. Step 3 depends on Step 2 because demographic registration should only continue once contact has been made and the client agrees to move forward. Step 3 is the client demographic or registration form. This form captures the client's full legal name, date of birth, address, phone number, email, gender, preferred name, race, ethnicity, household information, and other identifying details. This information must be accurate because it supports identity verification, record creation, insurance checks, clinical documentation, and communication. Step 4 depends on Step 3 because emergency contact and physician information must be linked to the correct client record. Errors in demographics can cause errors throughout the entire intake packet. Step 4 identifies who PHSNC should contact in case of emergency and documents the client's preferred physician or medical provider. This step supports safety, care coordination, and emergency response. It also helps staff identify medical contacts when additional information or referrals are needed. This step depends on accurate demographic information from Step 3. Step 5 depends on this step because medical and insurance coordination often require accurate provider and contact information. Step 5 documents the client's insurance, Medicaid, MCO, policy number, eligibility details, and payer information. This step is essential for determining whether PHSNC can bill for services, whether authorization is needed, and whether the requested service is covered. This step depends on Step 3 because insurance verification requires accurate identifying information. Step 6 depends on this step because initial screening must consider payer requirements and available covered services. Step 6 is the initial screening form. This form gathers basic information about the client's current concerns, behavioral health needs, substance use concerns if applicable, social needs, current supports, and requested services. This step helps determine whether the client appears appropriate for further assessment and what type of service may be needed. This step depends on steps 1 through 5 because staff need referral information, client contact information, and payer information to properly screen the client. Step 7 depends on this screening because risk must be evaluated in the context of the presenting concerns. Step 7 is the risk screening form. This step identifies immediate safety concerns, including suicidal thoughts, homicidal thoughts, self-harm, abuse, neglect, substance withdrawal risk, overdose risk, domestic violence, medical instability, or other urgent needs. Risk screening is critical. If risk is identified, staff must follow PHSNC policy, notify the appropriate supervisor or licensed professional, and ensure immediate safety actions are taken. This step depends on the initial screening form because risk is evaluated based on what the client reports. Step 8 depends on Step 7 because admission eligibility and level of care cannot be determined without first considering safety and risk. Step 8 determines whether the client appears eligible for PHSNC services and what level of care may be appropriate. This form considers the client's presenting needs, risk factors, payer requirements, service definitions, medical necessity, and whether PHSNC can safely and appropriately serve the individual. This does not replace the clinical assessment, but it helps determine whether the intake should proceed and what service pathway is most appropriate. This step depends on Steps 6 and 7 because eligibility and level of care cannot be reviewed without screening and risk information. Step 9 depends on Step 8 because consent should be obtained before proceeding into formal services and assessment. Step 9 is the consent for treatment or voluntary admission form. This confirms that the client or legal guardian understands they are voluntarily participating in services and gives permission for PHSNC to provide care. This step must be signed before services begin unless an emergency exception applies under policy. This step depends on Step 8 because the client should understand what service pathway they are entering. Step 10 depends on this consent because informed consent gives more detailed information about service expectations, risks, benefits, and client participation. Step 10 is the informed consent for services. This document explains the nature of services, client participation, potential risks and benefits, confidentiality limits, staff roles, telehealth or in-person expectations, and the client's right to ask questions. This form helps ensure the client understands what they are agreeing to and supports ethical, person-centered service delivery. This step depends on Step 9 because the client must first agree to participate in services. Step 11 depends on this step because confidentiality and privacy must be explained as part of informed participation. Step 11 documents that the client received or was offered the HIPAA Notice of Privacy Practices. This explains how PHSNC may use, disclose, and protect the client's health information. Staff must ensure the client understands that privacy is a right and that PHSNC is responsible for protecting confidential information. This step depends on Step 10 because privacy is part of informed service participation. Step 12 depends on Step 11 because clients receiving substance use disorder services may have additional confidentiality protections under 42 CFR Part 2. Step 12 is the 42 CFR Part 2 acknowledgement. This is especially important for clients receiving substance use disorder services. 42 CFR Part 2 provides additional confidentiality protections for substance use disorder treatment information. Staff must explain that SUD-related information generally cannot be disclosed without proper written consent, except where permitted by law. This step depends on Step 11 because staff must first explain general privacy rights before explaining the additional protections that may apply to sued services. Step 13 depends on this step because client rights include confidentiality, privacy, informed choice, and protection from improper disclosure. Step 13 documents that the client has received and understands their rights and responsibilities. Client rights include dignity, respect, confidentiality, informed choice, participation in treatment planning, freedom from abuse or neglect, access to grievance procedures, and the right to receive services without discrimination. Client responsibilities may include participating honestly, respecting others, keeping appointments when possible, notifying staff of changes, and working toward treatment goals. This step depends on privacy and confidentiality information from steps 11 and 12. Step 14 depends on this step because clients must understand their rights before they can fully understand how to file a grievance or complaint. Step 14 explains the grievance and complaint process. Clients must know how to report concerns, who to contact, how complaints are reviewed, and that they will not be retaliated against for filing a grievance. This step supports transparency, accountability, and client advocacy. This step depends on Step 13 because grievance procedures are part of client rights. Step 15 depends on this step because clients must also understand how PHSNC responds to medical or emergency situations. Step 15 gives PHSNC permission to seek emergency medical care if the client experiences a medical or safety emergency while involved in services. This is especially important for community-based services, group services, or situations where urgent medical intervention may be needed. This step depends on emergency contact and physician information collected in Step 4, as well as risk information collected in Step 7. Step 16 depends on this step because release of information may be needed to coordinate care with emergency contacts, physicians, hospitals, schools, courts, or other providers. Step 16 is the release of information form. This form is completed when PHSNC needs permission to communicate with another person, provider, agency, school, court, hospital, MCO, family member, or support person. The release must identify what information can be shared, who it can be shared with, the purpose of disclosure, expiration date, and any special confidentiality requirements. For substance use disorder information, the release must meet applicable 42 CFR Part 2 requirements. This step depends on Steps 11 and 12 because staff must understand HIPAA and 42 CFR Part 2 before requesting or using a release. Step 17 depends on this step because the licensed professional may need outside records or collateral information to complete the assessment. Step 17 is the Comprehensive Clinical Assessment or Biopsychosocial Assessment. This step is completed by a licensed professional or approved designee. If PHSNC has an agreement with an outside agency or provider, that approved designee may complete the assessment according to the agreement and applicable standards. This assessment gathers clinical information about mental health, substance use, medical history, trauma, family history, social needs, strengths, risks, functioning, diagnosis, and treatment recommendations. This step is one of the most important parts of the intake process because it establishes clinical need and medical necessity. Step 17 depends on Steps 1 through 16 because the licensed professional needs accurate referral information, screening information, consent, privacy acknowledgments, releases, risk information, and payer details before completing the clinical assessment. Step 18 depends on Step 17 because diagnostic justification must come from the assessment findings. Step 18 documents the diagnosis or provisional diagnosis and explains the clinical justification for that diagnosis. The diagnosis must be supported by symptoms, duration, functional impairment, history, risk factors, and assessment findings. It should not be guessed or copied without support. This step is essential for medical necessity, service planning, authorization, and billing compliance. This step depends directly on Step 17 because the diagnosis must be based on assessment information. Step 19 depends on this step because medical history and medication information help determine whether additional coordination or clinical considerations are needed. Step 19 captures medical history, current medications, allergies, recent hospitalizations, chronic conditions, current providers, and any health-related concerns that may affect treatment. This step supports whole-person care and helps identify whether medical coordination, psychiatric referral, medication management, or safety planning is needed. This step depends on Step 17 because medical history should be reviewed as part of the full clinical picture. Step 20 depends on this step because cultural, language, and accessibility needs may affect how medical and behavioral health care are delivered. Step 20 identifies cultural considerations, language needs, communication preferences, disability accommodations, transportation barriers, literacy concerns, spiritual considerations, and other accessibility needs. At PHSNC, person-centered care means recognizing and respecting each person's identity, background, strengths, and barriers. This step helps ensure services are accessible, equitable, and respectful. This step depends on the assessment and history information from steps 17 through 19. Step 21 depends on this step because the person-centered plan must reflect the client's needs, strengths, preferences, barriers, and accommodations. Step 21 is the person-centered plan or initial treatment plan. This plan identifies the client's goals, needs, strengths, preferences, service recommendations, interventions, frequency of service, measurable objectives, and expected outcomes. This is where the golden thread becomes clear. The plan must connect back to the referral, screening, risk factors, assessment, diagnosis, and client-identified goals. The treatment plan should not be generic. It must be individualized, medically necessary, and connected to what the client wants to achieve. This step depends on steps 17 through 20 because the plan must be based on assessment, diagnosis, medical history, and cultural or accessibility needs. Step 22 depends on this plan because crisis and safety planning must reflect the client's actual risks, supports, and treatment needs. Step 22 is the crisis or safety plan. This plan identifies warning signs, triggers, coping strategies, emergency contacts, professional supports, crisis numbers, safety steps, and actions to take if the client becomes unsafe or unstable. This plan should be individualized and realistic. It should reflect the client's risk screening, assessment findings, support system, and treatment goals. This step depends on steps 7, 17, 18, 19, and 21 because crisis planning must be based on identified risks, diagnosis, clinical needs, medical concerns, and the treatment plan. Step 23 depends on this step because the client orientation must include what to do in a crisis and how to access support. Step 23 is the client orientation checklist. After the clinical assessment and planning steps are completed, the intake specialist, or QP, reviews important service information with the client. This may include program expectations, staff contact information, appointment procedures, documentation expectations, crisis procedures, confidentiality reminders, client rights, grievance procedures, attendance expectations, and how services will begin. This step depends on steps 17 through 22 because the orientation must be based on the actual service recommended, the client's treatment plan, risk needs, and safety plan. Step 24 depends on this step because clients must understand the program before signing program expectations. Step 24 documents that the client understands the expectations of the specific program they are entering. Program expectations may include attendance, participation, communication with staff, respectful behavior, safety expectations, group expectations if applicable, documentation requirements, telehealth expectations, community-based service expectations, and discharge or transition expectations. This step helps prevent confusion and supports a clear working relationship between the client and PHSNC. This step depends on step 23 because expectations should be reviewed during orientation before the client signs acknowledgement. Step 25 depends on this step because service-specific forms must align with the program the client is entering. Step 25 includes service-specific forms based on the program the client will receive. These may include forms for outpatient therapy, peer support services, substance abuse intensive outpatient program, or substance abuse comprehensive outpatient treatment. These forms may include schedules, group expectations, peer support orientation, SAOP or SACOT attendance expectations, transportation arrangements, service-specific consents, and any additional program requirements. This final step ensures the intake packet matches the client's approved service pathway. This step depends on the entire intake process. The service-specific forms must match the referral, screening, eligibility review, assessment, diagnosis, person-centered plan, safety plan, and program orientation. Once Step 25 is complete, the client record should be reviewed for completeness before services begin. The intake process creates the golden thread. The referral tells us why the person is seeking help. The screening tells us what concerns are present. The risk screening tells us what safety concerns must be addressed. The eligibility review tells us whether the service is appropriate. The consents allow us to proceed ethically and legally. The assessment identifies clinical needs. The diagnosis supports medical necessity. The person-centered plan identifies goals and interventions. The crisis plan addresses safety. The orientation prepares the client for service. The service-specific forms confirm the correct program pathway. When each step is completed correctly, PHSNC can provide care that is person-centered, compliant, clinically appropriate, and ready for documentation and billing. When a step is incomplete, the golden thread can break. All staff have a role in protecting the integrity of the intake process. If you complete Step 1, make sure the referral information is clear, accurate, and immediately routed to the intake specialist or QP. If you complete Steps 2 through 16, make sure all intake information, consents, acknowledgments, releases, and screenings are complete before the clinical assessment stage. If you complete Steps 17 through 22, make sure the clinical assessment, diagnosis, treatment planning, and safety planning are individualized, clinically justified, and connected to the information already gathered. If you complete Steps 23 through 25, make sure the client understands the program, expectations, safety procedures, and service-specific requirements before services begin. Each person must review their assigned section before passing the intake forward. At Fila Health Systems of NC, intake is where service begins. It is where we listen, gather information, identify needs, protect rights, address risks, and build a pathway toward care. Every step matters, every form matters, every signature matters, every staff member matters. When we complete the intake process with accuracy and compassion, we help individuals and families move closer to stability, recovery, independence, and their dreams. This is how we live the PHSNC values of purpose, heart, impact, leadership, and advocacy. This is how we fulfill our hero statement, helping you live your dreams every day.